Good evening, everyone. Welcome. We might get started. Thank you so much for joining us tonight for this exciting event. Brisbane North PHN Network is presenting My Aged Care Services, which is a joint presentation from the Team Care Coordination, the Primary Care Team, and one of our GPLOs, which is a General Practitioner Liaison Officer. My name is Claudia Savage, and I'm the lead here for Primary Care Initiatives at the Brisbane North PHN. The purpose of the webinar tonight is to help inform, educate, and support general practices in our region for My Aged Care Services. For older patients, My Aged Care may be the starting point to accessing government funding aged care services. So before we get started, I'd like to offer an acknowledgement. We acknowledge the traditional custodians across the lands in which we are meeting today, and we acknowledge the land, the sky, and the waterways. I'd like to acknowledge their ancestors and elders and recognise those who continue to protect and promote Aboriginal and Torres Strait Islander cultures. We acknowledge the past and we stand together for the future. So to start off with a little bit of housekeeping, we will have time at the end for the webinar to answer your questions. So please add them into the Q&A section. And if we don't get to them, be rest assured that we will add them to our FAQ resource. If we're not able to answer them tonight, due to it not being our area of expertise, we'll send them out after the webinar. Tonight's webinar will go for 60 minutes. The webinar tonight is being recorded, so if you're missing it or you're not able to stay for the whole time, it will be sent out after the webinar has finished. Once this webinar has finished, there will be a survey, which will be an evaluation of the webinar. We really encourage you to fill it out so we can help to inform and improve information sessions like this one tonight. Our slides and any related resources that we discuss tonight, along with our FAQ resource, will be sent out, but please note this may take up to 2 weeks to be sent. And lastly, we have a QR code at the end of the slides to help with your pre-filled quick log for your CPD hours. So tonight's presenters. Starting on the left, we have Jenny Evans from Team Care Coordination, who is supported by her team leader, Lisa Creed. And then we have in the primary care team, Tammy Archel, who is supported by Michelle Casella. And then we have our GPLO, Dr. Kylie Norris. Oh, wrong way. So having a look at the agenda tonight, we will be going through the My Aged Care Service. So having a look at the eligibility, the types of support, the referral process, and what the future of My Aged Care looks like. Having a look at the referral process for Team Care Coordination. We will be going through on how to identify your patients for My Aged Care, some PDSA examples, a Q&A section, and then we'll finish off with a conclusion. And now I'd like to head it over to Jenny, who will be discussing what My Aged Care is. Thanks, Jenny.
Thank you. Good evening, everyone. A really warm welcome to you all. Thank you for giving your time to our talk this evening. My name's Jenny, and this is our team lead, Lisa Creed. We wanted to share with you some information about what My Aged Care is, how your patients can access it, and the types of support people can receive, and briefly look at what we know about the changes resulting from aged care reforms. So tonight's information comes from our PHN publication called Supporting Patients to Access Aged Care Services, and you're all going to get a copy of that with your resources this evening. So let's start first of all with what My Aged Care is. So My Aged Care is the government organisation that determines a person's eligibility for funded aged care services for older Australians and their carers. My Aged Care is the entry point for eligible people. Aged care services can be short-term, such as restorative, to improve a person's independence or well-being. They might be episodic, so it might be a course of nursing support to heal a wound, or a course of physio. Or it might be longer term supports like domestic, shopping, transport, or social options. Eligibility for MyAge Care. So the eligibility criteria is age. So a person has to be 65 years or older, or 50 years or older for Aboriginal and Torres Strait Islander people. People have to be assessed as eligible by a MyAge Care assessment service. So the regional assessment services assess persons' eligibility for the Commonwealth Home Support Programme, and the aged care assessment teams assess people's eligibility for the Home Care Package Programme and also residential aged care. It's important to note that eligibility is based on current support needs, not future or anticipated needs. So it's really important that you encourage your patients to talk with their assessors about what their current support needs are and why. An example being, I have arthritis in my shoulders and knees. I get a lot of pain and stiffness. I can't push a vacuum or hang out washing anymore. So the assessors need really clear information in order for them to approve the appropriate services and support. Also, services that are approved belong to an individual, not the couple. So they may benefit both people, as in domestic support, but the services are approved on individual eligibility. The types of support. So there are two programs. The Commonwealth Home Support Programme, or CHISP or CHSP, is the entry-level programme. For this, you need to have a regional assessment service assessment. It's recommended for people needing 1 or 2 ongoing or episodic services. You can see there that the types of support might be nursing to help with wound care or perhaps insulin administration. Flexible respite. So this might be respite in the home during the day or sometimes overnight. It might be centre-based day respite, and that's during the day at a day centre. Usually people get picked up by a transport service. There'll be activities, entertainment, outings, and they get a meal provided and then taken home. There's also something called cottage respite, which is 2 or 3 days stay in a community setting for people with lower level care needs. Allied health type services include podiatry, physio, occupational therapy, dietetics, counselling, social work, exercise physiology. Personal care is things like showering, help with stocking application, basic medication support. You all know about things like Meals on Wheels, transport services. Specialised support is services such as dementia advisory support, continence advisory support, vision and hearing service support. Home modifications is things like a grab rail installation, that kind of thing. Housing assistance might be providing support in looking at housing options and accessing those types of things. All aged care services are subsidised. If a person is in great financial distress, they can approach their service provider to be considered for a financial hardship application to see if the fee can be reduced or waived at all. The Home Care Package Programme is for people with complex changing needs who want to stay in their own homes as long as it's safely possible to do so. There are 4 levels of home care package, as you can see here. And they provide a range of individualised in-home support services. These services are episodic, individualised, scheduled care. So it's not round the clock, 24-hour care. People can choose to self-manage their home care packages. A lot of people choose to have a care coordinator who will organise and coordinate their support with them based on their assessed needs and priorities. So you need to have an ACAT assessment to determine your eligibility for a home care package. And once you've had that assessment, the ACAT team will send the person a letter. And it will give reasons and evidence to support the decision and what the person is approved for and eligible to receive. And the person will receive a copy of their support plan. After the ACAT assessment, and they've been approved for a home care package, they'll be assigned a level of home care package and a priority of wait time for the home care package to be available. They go on to the national queue until the home care package funding is available to them. In the meantime, though, the person can start gathering information so that they're prepared once they've been assigned a home care package. And they'll get a letter to say their home care package is assigned. But whilst they're waiting, they can maybe look at home care package providers. So there's a Find a Provider tool on the My Aged Care website. The person, or perhaps a trusted support person, can help them look at providers, and they can ring providers and find out information about what they can offer. And they can also look into any potential costs and fees that they may have to pay towards the home care package. The home care package programme is income tested, and Services Australia guide people about any potential fees or charges they might have to contribute. It's also important to know that if a person's support needs change whilst they're waiting for either an assessment for a home care package or for the home care package to be assigned, they can call My Aged Care or ACAT to advise of the changing needs. An ACAT may be able to review the person and their situation and the priority of the assignment of the home care package or their assessment. Or they might be able to approve some interim services under the Commonwealth Home Support Programme that the person can use in the meantime. Two other programmes that are available through My Aged Care are the short-term programmes. You need to have an ACAT assessment for both of these programmes. The short-term restorative care programme is to help a person improve their health and well-being. And this programme is delivered in a person's own home and runs for about 8 weeks. And it's suitable for people who are struggling with day-to-day activities like bathing, dressing, eating, shopping, and driving. The Transition Care Programme is aimed at helping people recover after being in hospital. And this is tailored support from occupational therapists, physiotherapists, nursing, technology, might be a little bit of home maintenance such as a grab rail installation. It's aimed at helping people regain function, remain independent, and delay or avoid early entry to residential aged care. And this runs for about 12 weeks. This programme can be delivered in a person's own home, in the community, or in residential aged care. So, support for people with high care needs. So, there's a residential aged care programme, and people can access both permanent care and respite care. And this programme is for people with ongoing, changing high care needs, needing help with everyday tasks, such as personal care, nursing, or medication type support. People need to have an ACAT assessment. This is a means tested programme, so people again need to contact Services Australia to find out information about potential fees. The residential respite programme is short term. It's usually a minimum of 2 weeks. It's up to 63 days per financial year. But if people are really struggling, sometimes they're able to access a 21-day extension with approval from ACAT. So let's look at the My Aged Care assessment and referral pathways. So My Aged Care is a contact centre with inbound calls and referrals only. And their staff support people to register and undergo basic screening to determine if the person needs an entry-level home support assessment from a regional assessment service or a more comprehensive assessment from an ACAT team. So the person is screened and registered with My Aged Care. They're given their own personal identification number, a bit like a membership number. Starts with AC and then 8 digits after it. And then the person is assessed by the service, approved for services, and then they're given referral codes for those services. And the person or their support person can then approach providers to deliver the services. How to refer to My Aged Care? Well, it's actually really quite streamlined now. So a lot of people are quite able to call in on that public number there, 1800 200 422. There's also a phone line there for health professionals, which we can all use. And that's really helpful to call in if you need information with the person's consent about approvals and any pending assessments. It's also really helpful to encourage your patients to add a family member or a trusted person as a representative who can speak and act on their behalf if ever they were too unwell to do so. That's actually a really good tip to encourage people to do that. And the other thing that's really helpful these days is to get people to link in their My Aged Care to their MyGov account. It's really easy. People go onto their MyGov account, and like you would link in the tax office or Centrelink, you just link in the My Aged Care account with that number, that AC number with the 8 digits. So referral options for us. So we can use the online referral form on the My Aged Care website, or in the primary care setting, you can use the e-referral option from within your patient's electronic medical record. So we know that there are some aged care reforms happening, and there are lots of changes, and they're all being rolled out. I personally find it really helpful just to link into the Department of Health and Aged Care on there. You can get emails sent to them, and we're going to send round the latest information, which actually came through last night, on changes to aged care in Australia. We do know there's going to be a single assessment system to simplify and streamline and improve access to aged care services. And we know that there's going to be a support at home programme. So there's going to be reforms to the in-home aged care programme. And I do encourage you to link into the department's communiques. They're really helpful. So here in Team Care, what do we do? What do we consider? Because we recognise that it's difficult to access some services, in particular things like domestic, occupational therapy, gardening support. We start off and we talk with the person, and we make sure that you as their primary team are aware that their health has changed. So we encourage people to consider a review with their GP, their primary team, so that you know about the changes in their health. Sometimes we find that people need chronic disease education. They might need things like a Webster pack, a home medication review. Are they concordant with their medication? Can they get to their pharmacy to pick up their medication? Recently, there was a person who was struggling with affordability of medication. And there were things that we were able to do that enabled him then to be able to afford his medication. And then he was able to take his medication, and that helped him with his symptoms. We try to think laterally. So another example recently was a person wasn't able to access domestic support. And there was quite a significant carer strain going on in this home. What we were able to do, though, was access some centre-based day respite and in-home respite. That gave the carer a break, and the carer was then able to do more of the domestic and felt more supported because they were having a break in other ways. So we look at the person and what approvals they have available to them. We also consider things like the GP management plan or team care arrangements. We see if the person might be eligible for the medical aid subsidy scheme or the continence aids payment scheme to help with continence aid support. If a person's a veteran, we encourage them to contact Veterans Affairs or Veterans Home Care. We talk to people about the Carers Gateway, the government organisation for carers. Carers can ring in, register, and that registration lasts a year. And Carer Gateway will talk through options available to support the carer, both in the home and residential care options too. We see what family and friends can offer. So sometimes there might be a grandchild that the person can pay to mow the lawns occasionally. We sometimes find that people have volunteer groups or private services that they're able to afford or access. So we just look at the person all round. We see if the person might be eligible for taxi subsidy, that kind of thing. So team care coordination. So who we are. So we're a free programme available to anyone over the age of 18 living in the Metro North Hospital and Health Service area with a chronic disease and preferably a GP in the region too. So we're not a service provider, but we're free and we help people coordinate their health, linked to services and supports, and we provide some chronic disease education too. And we work in partnership with people for around 12 weeks at their pace. We can also offer service navigation. So we've got our service navigation helpline, which is open Monday to Friday, 8 to 4. And you can ring in, discuss referrals, and get advice and information about health and community services available. Who should you refer to team care? Well, think about referring people perhaps who have poor health literacy or maybe trust issues with health and social services. Perhaps some people from non-English speaking backgrounds, people who might be isolated and vulnerable with limited supports available to them. Maybe people with communication difficulties who might benefit from a face-to-face visit. Some examples here might be people who've had, say, several recurrent falls, people who are struggling to manage their chronic disease, people who are frequently presenting to hospitals or to your practices, or maybe conversely, people who are missing appointments, who've generally been quite regularly attending, but they're missing appointments, or maybe they're forgetting things, or maybe they're losing weight or just looking a bit unkempt, and you just get that flag that something's just not quite right. So people can self-refer to us. You can ring in with a referral, you can refer via medical objects, or you can fax referrals through to us. Or GPs, you can refer on the e-referral template found on our website that will be circulating through medical software. So thank you, everyone. We've got some questions that we'll be answering at the end, and I'd now like to hand over to Dr. Kylie Norris.
Hi everyone. I'm not Michelle Casella, as it says there. I'm Kylie Norris. I'm a GP and a GP liaison officer. I work at the Bowden-Wainworth Medical Centre, and I certainly have a large cohort of older patients and those with chronic diseases as well. I'm very fortunate in our practice that we have excellent nurse support in-house, and they certainly assist me in completing activities such as the over 75 health assessments and GP management plans. And look, certainly over the years, I've referred many of my patients to Team Care, and I'm very grateful for their service and their input. So when I consider which patients are suitable to refer to Team Care, there's certainly two groups. So there's the ones that are quite well known and obvious. So those ones, and it's certainly quite obvious to the nurses and sometimes even the receptionists as well. The groups we're considering are the frail elderly, those ones not coping at home, those people requiring increased assistance to be staying at home, those with chronic complex diseases, and also the frequent presenters. But then there's the population or the cohort that is the unknowns. So sometimes these patients, their presentations into the surgery have just dropped off a little bit. That may be due to mobility issues, reduced social support, some cognitive decline. They present to the surgery often in a crisis situation, so there's no time often during that appointment to be organising anything beyond the main issue. You might bring up the idea of them coming back and completing a management plan or a 75 health assessment, but often those routine appointments they may, for various reasons, not follow up with. These patients are often using the ambulance or the hospitals for a lot of their care needs. So how in my practice do I identify the patients that we consider in the unknown cohort? Our practice is using Primary Sense, and so recently I received a visit from my friendly PHN QI engagement officers, which are Michelle and Tammy. We discussed what types of searches might be relevant to detecting patients that could benefit from a referral to Team Care. And so now I'd just like to hand over to Tammy, and she will present to you what the advice they gave me. Thank you.
Thank you, Dr. Kylie. In our role as engagement and quality improvement officers, my colleague Michelle and I were happy to support you with this CQI activity. We're available to support all general practices working in CQI, continuous quality improvements. Sorry, just 1 second. Our main platform, Primary Sense, is a health management and data extraction tool that supports GPs as well as all practice staff for patient outcomes. One of the reports used to support Dr. Kylie was the patients with high complexity 5 and 4, as displayed on the screen. All data in this report is not of any real patients. To support your higher risk patients, they can be identified by the ACG score. as noted by the top red arrow, level 5 and level 4. The ACG score stands for Adjusted Clinical Grouping Score. Level 5 is defined as high complexity and level 4 is defined as high to moderate complexity. The second red arrow on the screen, export to Excel. This data can be exported to Excel for easy sorting. All you need to do is click on the Export to Excel button. Once exported to Excel, you can put the data into sortable tables or adjust the columns to hide and remove to make it easy to work with only the data you require. The data listed in this report shows patient name, last visit, any existing appointments in the next 2 weeks, GP name of the patient, age, Aboriginal and Torres Strait Islander status, and hospital risk percentage. The report displays the number of medications and the date of the last medication management review. It also supports patients due for care plans, GPMPs, TCAs, and reviews. This is another example of a report Dr. Kylie used, the Frailty Care Management. And again, all the data in this report is not of any real patients. Which data is included in this report? Patients 65 years and over with a frailty indicator, including falls, nutrition issues, lethargy, and feeling depressed, recorded in the past 2 years or marked as active conditions. Patients with a frailty score, identified patients with incontinence, skin ulcers, and dementia. Frail patients who might be at risk of seasonal respiratory infections. And this report can also be exported to Excel. This report lists hospital risk percentage, number of chronic conditions, Aboriginal and Torres Strait Islander status, if the patient lives alone. It captures the frailty indicators as well as a history of chest infection. The report can help you identify opportunities of frailty care management. Here is an example of the templates and resources Brisbane North PHN has available to support with your quality improvement documentation. This is an example of a CQI activity using our PDSA template. Dr. Kylie used this activity to increase the number of patients referred to the Team Care Coordination Program. The goal, what are we trying to achieve? Dr. Kylie identified patients on the Primary Sense Complexity Level 4 and 5 report, reviewed and invited them into the Team Care Coordination Program. The measure. What will we use to track achievements of the goal? The number of patients on the Primary Sense Complexity 4 and 5 report is the measure. Idea for change. What are we implementing? Dr. Kylie utilised the Primary Sense Complexity report to identify patients, and next she will share her experiences. We can support you make continuous quality improvements easy. Don't forget, our team is always available to support you, just like we've supported Dr. Kylie. Now over to you, Dr. Kylie.
Yes, thanks, Tammy. And so I'd just like to summarise a few of the things that I learnt by completing the audit and the search. And look, the first one was it's really helpful to have a team approach to doing these types of quality improvement activities. Starting with the audit, like my computer skills aren't particularly good, so having Tammy and Michelle there to help with doing the searches was very helpful. I must admit, my practice manager and the nurses have become very good using these tools as well. And including that in the team approach as well, though, our nurse that does a lot of the chronic diseases management, it was a useful list for her as well, just for looking at management plans and various other things that were needing to be updated. But saying that, you do get a list and it does require interpretation. And so I did need to look through this list. Some of the patients were already on care packages, especially with the high levels of frailty. so would not be suitable to be referring to team care. And some of them I know certainly would not be accepting or needing of interventions because they have some of their own supports in place already. It's always, the searches I've done, this is, I did a diabetes one as well with assistance of Michelle last year, but there's always data cleansing that needs to be done. So and certainly in terms of the frailty and that the high complexity patient cohort that was listed here, some of them have moved on. They've either gone to aged care facilities, moved away from the practice, and not that I had any, but you certainly could have, you know, a couple of patients in that list that could have deceased and you haven't inactivated the charts. Certainly, as I was mentioned before, why it was handy to give this list to my nurse, that there were some patients on this list. These are, you know, complexities of patients of high complexity, and some of them I didn't even have a GP management for. So, you know, some of these patients have got several chronic diseases or complex care needs, and they really need to be having, and it's good practice, I think, to be having a management plan and or a review updated for this patient cohort. The other thing that one of the columns that you saw in those lists were medication reviews. I had 34 patients on my list, and only one of these had a medication management review in date. It's one of those things that often I put on the back burner a bit, but again, patients with chronic complex disease and high complexity needs are often on a lot of medications and would certainly benefit from a in-date medication management review. The other thing that I find, I looked through this list, and as I said, a lot of them I knew very well. But sometimes it's good to just even reinforce these are the patients that could be just deteriorating quickly. So now is the opportunity, and especially through using a service such as Team Care Coordination, to really get assessments updated, get services in place to prevent poor outcomes there. And of course, the last thing that I'm thinking of as well is that some of these patients would certainly benefit, or many of them would benefit from a referral to Team Care Coordination, which certainly just helps to get the big picture, put services in place, and just give them that better quality of life. So that's it from me. I'd just like to hand back to Claudia. Thank you.
Thanks so much, Kylie. So now we'll go through the questions. Lisa, if you want to answer some of those initial questions.
Great, thank you, Claudia. First, we just wanted to acknowledge in the slide around the home care packages, there was a bit of an error there. So home care package level 4 has allocated funding of 59,593. So we will update that slide before we send that out. So apologies there. So the first question here is, what are the best options for patients who just need transport funding?
Thank you, Jenny. So for people under 65, generally, we would consider, with their permission, referring them to the Queensland Community Support Scheme. For people over 65, we might encourage them to seek an assessment through My Aged Care. And there's different types of transport available. So some people might need an escort to take them places. Other people might need a volunteer driver. So My Aged Care the assessor will help the person determine what's best for them. We might talk with the person and get them to inquire if they're eligible for taxi subsidy at all. We sometimes talk to people about council cabs. So in certain areas, people can access council cabs if they're over 60 years old, mobility impaired, have a concession card. And a one-way fare there is between $1 to $2.50. Through Brisbane North PHN, we also have a Car Free Me programme, which the PHN commissioned, and that's with the CALD communities. So that's useful to know about as well.
Thanks, Jenny. What is the process if a patient is needing services urgently via My Aged Care, and how can a GP practice help to facilitate this?
Another good question. So you may or may not be aware that you can ring My Aged Care and arrange a direct to service referral for certain types of support. And these types of support are help with meals, nursing, so if somebody has a wound, transport to medical appointments, and personal care, things like hygiene. So they can access these short term whilst they're waiting for a My Aged Care assessment. If the person is at imminent risk of hospitalisation, the GP may be able to do a smart referral to the Rapid Access to Community Care programme, who can visit them at home within a few days and assess the person's situation, and then liaise with, it might be a geriatrician referral, it might be trying to speed up an ACAT assessment. The person can also, or their carer can also call the Carers Gateway to see what supports they can access through the Carer Gateway to support them as well. Thank you.
Thanks, Jenny. And the next question we had was what are the current waiting times for services? So looking at if it's a Commonwealth Home Support Program referral code, and then what are the wait times for home care packages?
Thank you. So wait times are variable. Sometimes you can access services under the Commonwealth Home Support Programme quite quickly. Meals being an example. Other types of services, there might be a long wait, like domestic, gardening, those types of services. The Home Care Package Programme, we're going to circulate the latest information from the 31st of March. The My Aged Care website regularly updates home care package wait times. If a person is medium priority for a home care package, the latest wait times are level 1 is less than a month, level 2 is 3 to 6 months, level 3 is 9 to 12 months, and a level 4 medium priority is 6 to 9 months. Thank you.
Thanks, Jenny. This next question relates more to the primary care team, but it's any clarity about the new aged care incentive starting in August to replace ACIA. And the primary care team don't have an update on that one at the moment, but they will reach out to you once they have some further information there. Another question was around attending the Zoom, which was addressed earlier on, and this session has been recorded and it will be shared afterwards. And then that question was just repeated, but we did then have another one come in late this afternoon, and that is, how can we bypass getting a RAS assessment when an ACAT assessment is required, despite having already requested an ACAT? Current wait is 4 to 5 months from the day ACAT received the referral, which is only sent after a RAS assessment has been completed.
Thank you. Another good question. It's really important to let ACAT know about the person's changing needs. So sending really comprehensive information about the changing need, the impact on the person's life, the current supports they have, or if they're very isolated and not coping, so that ACAT know they can review that person's situation, possibly reprioritise when they do the assessment. Consider also direct to service referrals, like we mentioned before, for things like meals, nursing, transport, help with showering, personal care. Consider respite services. Family or friends, see if there's anybody who can offer anything, that concept of gathering your crew around you when you're not well. But also remember that the Commonwealth Home Support Programme approvals are really helpful in the interim. So there may be services that a person can access which just might help them in the short term whilst they're waiting for an ACAT assessment or waiting for an assignment of a home care package. Maybe helping them access some short-term residential respite care or cottage respite may be options too. Thank you.
Thank you.
Thank you to everyone who pre-submitted their questions. We do have 2 more questions in the chat. The first one being, will I still be able to refer a frail older person who has a home care package level 4 to the team care team?
Yes, you most certainly can refer them, and we'll look at them by case. I know historically, level 3, 4 clients do get extensive funding, but we are willing to look at them on a case by case. So yes, feel free to refer them on. Thank you.
Thanks so much, Lisa. And then the second question was, my father is 90 and it's impossible to get lawn mowing help. What can I do? I would do it, but I'm away for work. How can we assist?
It's really not easy to get subsidised lawn mowing. A lot of people are having to get private lawn mowing services in place. If there's any family, neighbours, grandchildren, that sort of thing, paying them is often helpful. Getting their names on a wait list too is a good thing to do. So some service providers do accept people to wait list for lawn mowing. And that can be helpful. No easy answer though, sorry.
Thanks, Jenny. We've just had 2 more questions come in, and I think you answered it. What is the cost of the team care coordination, and is it means tested?
Team care coordination, we're a free service. So team care coordination is funded by Queensland Health. So
Wonderful.
It's free for anyone over 18 with a complex chronic disease.
Thanks, Jenny. And the second question is if someone is already receiving home support but would like a reassessment as their condition is changing and they'd like to get prepared to move into an aged care, can we arrange the reassessment or the person needs to call directly to My Aged Care?
If the person's capable, it's actually really good for them to call and put it across their situation. But you could refer to team care, you could help them call. The key thing is to get across to My Aged Care the changes and how it's impacting the person. So not just saying to My Aged Care, I need extra domestic help or I need help with showering. In order to have approval for subsidised services, My Aged Care need to have a rationale. They need to know what the health condition is or the changes in health that are impacting on the person and stopping them being able to live their lives to the best quality or as fully as possible. And there may be other things to consider too. For example, if it's a mobility issue, would a course of physio help? Things like that. How can we enable people to get back on their feet, re-able them? Thank you.
Thanks, Jenny. We've had 2 more questions come, 2 more. So one of our GPs is wondering if the Mabel app is linked into My Aged Care subsidies.
Not that I'm aware of, but I know that some service providers do use Mabel staff to deliver some of their services. And certainly if people are self-managing their home care packages, they do sometimes use Mabel staff, as long as they've had all the important checks like police checks, first aid training, etc.
Wonderful. Thanks, Jenny. And I can answer the last question. The answer is, will we get slides off this webinar and a transcript of the Q&As? Yes, there will be a copy of the slides sent to every person that registered. Unfortunately, we can't do a transcript of the Q&A. However, you can always watch back the last 20 minutes of the recording. Sorry, and there's one more question that's come in. What are wait times for ACAT assessment and RAS assessment?
So the ACAT assessment can be 4 or 5 months, but again, if a person's needs are changing, it's really important that you let ACAT know, and they might be able to reprioritise that. They've been working really hard at reducing their wait times. Do you have anything else to add?
No, nothing further to add.
The RAS assessment depends on which RAS agency they've been, or service provider they've been referred to. So there are 3 current providers in the Metro North Brisbane area, and they all have slightly different wait times for assessments. But again, they're all really approachable. If you ring them and you explain that change in need, you might be able to speed up the assessment. That, in terms of wait times, if it's a new assessment, it can be quite quick. If it's a support plan review, it's likely to be a few weeks before they have a RAS review.
Thank you so much, Jenny. So this is just the initial list of the related resources that we have gone through tonight. Anything else that Jenny, Dr. Kylie Norris, or Tammy has mentioned, we will link those in the pack that we'll send out to all of our registries as well. So thank you so much to everyone who has joined us for the My Aged Care Services webinar. And thank you so much for your questions and your engagement this evening. A huge thank you to the Team Care Coordination, the primary care team, and Dr. Kylie Norris for sharing your insight and your knowledge with us all tonight. Once this webinar has finished, we would really encourage and welcome you to fill out the after webinar survey, as it really does help us improve information sessions like this one tonight. And just a reminder that our slides, the recording of the webinar, the FAQs and related resources will be sent out. It may take up to 2 weeks. If you do require any further support or you have any further questions and you'd like to get in touch after this webinar, please don't hesitate to contact the Team Care Coordination or our practice support, and we can certainly help answer your inquiries. But thank you so much for your viewing and your engagement tonight, and I hope you have a wonderful rest of your evening. Bye.